So first of all, excuse me, I'm a little bit croaky because I seem to get more and more allergic to London, and it's a really high pollen day. So excuse me, and excuse me if I keep blowing my nose. So, but nextly, thank you very much for inviting me along today. I feel like I might have been slightly misled because I'm not going to do a whole session on what is leadership. I was going to do a really quick, these are some of the things I think leaders aspire to, and give you an overview of the many, many options that are out there at the moment. And the reason I say that is we had some feedback recently, and someone said there's so much stuff out there now, I don't know what to look at first. And they described it to me as it's like being invited to an all-you-can-eat buffet after you've had an enormous meal. So what I'm going to try and do today is give you some slides that you could look back at later. And what they asked me to do was think a little bit about how we might put in context what you look at and when in terms of your own development journey. So first of all, I just wanted to kind of say there's a couple of quotes I like about what is leadership, because one of the things I hear really regularly is I don't run a team, so I'm not a leader, or I'm not in a position to be a leader. And I think that's really untrue. I think you're all leaders all the time, aren't you? You know, you're leading what's happening with your patients, you're leading what's happening in your department, you're leading all kinds of situations. So I particularly like the leadership isn't about being great, it's about enabling others to be great. But I also think I like the leadership style can be defined as the technique and approach of providing direction, implementing plans and methods of motivating people. And in terms of your aspirations as a community of practice, that's exactly what communities of practice do, isn't it? You kind of all come together, you're driven by what your passion is, and you can draw on your really wide experience of that. Next slide, please. And so within the NHS, when I joined the Leadership Academy, so I come from a background I started out training as a nurse, and I worked in general practice for a long time, working with GPs so that they would prescribe methadone for stable drug misusers who didn't want to get stuck with the whole, I have to sit in the methadone maintenance clinic once a week and it's stopping me work or look after my family. So that's my background. And I think the reason leadership is really important in the NHS because it's around, and I could say personally, the better leaders I worked with, the better I performed, and that in turn turned into the better service we could provide. So I think for me, the aspiration is all about improving the overall experience, both for the teams of people I work with and for I don't know, should they be patients, citizens, whatever the right term is now, who use our services. Next slide, please. So I think there's a whole load of things we can think of, isn't it, when we think about our own leadership style. And the first time anyone said it to me, it made me kind of stop in my tracks, really. So what does it like to be on the receiving end of me as a leader? And it made me really reflect that what I think I've said and what people heard aren't always the same thing. So it made me really think about how I do that. And there's lots of 360 feedback tools out there, but I think it's a really great place to start in terms of thinking about how you are going to structure your own development journey next. And I'm really aware that in a clinical role, you have about 108 mandatory things you have to do as well. So finding time within your own development journey to do some of what would be almost considered softer skills can be a challenge, can't it? The 360 feedback tool I'm most familiar with is the healthcare leadership model. I would be right because it's developed by the Leadership Academy. I think it's quite robust in that it was developed across 9 domains that were considered important in terms of leadership for people, leadership with people in a healthcare setting. And the list is here and you can see them on the website that's at the end of it. If you're interested in going down that route, I make no money from it, I promise. It's 40 quid, but for 40 quid, you get to do this as an electronic system that you can invite as many people as you like, and you get a finalized amalgamated report and a facilitator who goes through that with you. So I think if you were going to do it, it's quite useful. I've also worked with teams where whole teams have done it together and then come back and kind of shared the themes around maybe what their learning needs are as a team going forward. So maybe having thought about it or done your own personal development plan. Next slide, please. I thought what I would do is run through some of the offers that are out there at the moment that might be right for you. And then you have 3 colleagues who are going to talk to you about programs they have done and the impact that it had on them. And you will be sick to death of hearing me talk by then. So I think it's much nicer, isn't it, then to hear from people who've actually done it rather than someone who is potentially trying to sell it to you. So I thought I would run really quickly through what coaching and mentoring is, some of the learning networks and peer supports that are out there, of which your community of practice will be one. There's a whole load of bite-sized modules which you can dip into as and when you want to. And then there's also some set programs, and definitely the 3 speakers coming next have done programs, different programs. So next slide, please. There's been a big push on coaching and mentoring, definitely since the pandemic began. And I'm a big fan of both of them. When I first started, I thought coaching was the thing you did when you were underperforming. So it's been a little bit of a journey for me, because I realized actually coaching is the thing when you're performing and you want to continue to perform more. So the way I describe coaching to people is it's a formal approach, and what it does is work with you to make you realize you already have those skills and decide how you want to use them to get where you want to go. And then there's also mentoring. So I don't coach, but I do mentor. And mentoring is usually when you link up with someone who has more experience in you and kind of pick their brains and learn from them along the way. So I would say I've been really lucky. I had 2 amazing mentors in my career, both of whom definitely encouraged me to do things I would never have dreamed of applying for in the first place. What I like to try and do when I mentor people is to introduce them to people or open doors that might not have opened for them straight away. And what I like about mentoring is I think it embodies the aspirations of Michelle Obama, who said you should lift as you climb. I really like that approach. So we have a free coaching and mentoring offer through the Leadership Academy, which the details for which are at the end. And there's also for people in primary care, there's the Looking After Your Health Too offer, which started out specifically to support primary care staff during the pandemic. And that, if you kind of end up there, it will take you to some links about some little standalone guides you can use if you want to. Next slide, please. So there's a lot of learning networks and peer supports out there. I think your community of practice is great. I love the idea behind communities of practice. I've seen some amazing pieces of work happen there. There are also action learning sets, and I think the difference between the 2 is a community of practice is a group of you who get together, who are inspired to bring about changes in the area you work in, and you draw on each other's kind of learned knowledge and experience and come up with ways to do that. Action learning sets will be smaller, usually about 6 to 8 people. They're quite focused on individual learning. So what they would be is within the group, people bring a specific problem and then draw on the knowledge of the rest of their group to kind of come up with solutions and plans of the way to change it. The NHS Futures, if you're not on the NHS Futures platform, I think it's really, really worth getting on it. And there's many, many, many groups in there at the moment. And for me, some of that have been really useful just to kind of hear what the presenting issues are. But there's also lots of toolkits and shared learning, and don't reinvent that because it's already here and you can find it at. Again, free to join, you just join as a member of the NHS. And the other thing that I came to probably later than lots of people were Twitter groups. So again, if you're really busy, they're really nice because you can dip in and out of them. And the 2 that I had the most to do with were, one was, if you don't know, at Flex NHS, which was started by a group of nurses who were looking to raise the thinking around flexible working, particularly for nurses within the NHS, because definitely the 2 nurses, so the 2 nurses who started it met at a conference, both of whom were, if we could just be a bit more flexible, I could stay in this role. Whereas if there isn't some give, I'm going to have to move on. It's huge now. It's got thousands and thousands of people part of it, and has become a real call for action website around. And they've done lots of work around things like flexible rostering, those kind of things. It's fun. It's there. And the other one, the Leadership Academy also has a Twitter feed, and we will often promote their really early on new offers. So I think they're interesting, and they will have structured chats as well, so which would drive the future of what we might develop next. So both worth looking into, I think. Next slide, please. And I was talking a bit about bite-sized learning. So I think which has been a real buzzword for us in the Leadership Academy. But bite-sized learning obviously would be small standalone topics. And the feedback we were getting is we don't want any more huge projects. I can't commit to something for the next 8 months, but I would really like to be able to dip into some things. So these were driven by what people said that would be useful to them. And I think some of the things in there that people have told me have been really useful are kind of quite structured things like what is time management, particularly if I'm working with members of my team. There's some stuff around succession planning, which I think becomes a bigger and bigger issue for people. And particularly I hear within nursing, there's a kind of anxiety about, will we lose a whole load of stuff, and how do we succession plan and make sure what we've been doing continues to work. And then I don't know, lots of people like imposter syndrome. It seems to me it doesn't matter how good you are in your job or how relevant it is that you're there. We all seem to have that little niggling imposter syndrome in there somewhere. And someone else was really recently asking me about how do I do things like interview skills. And so they have a little standalone module for that. Again, at the end, there's the link for how you sign on to that website. It's free and no one checks if you're using it lots or not at all. So if you want to just go in there and have a look around, or you want to go in there and direct one of your colleagues to it, really welcome to do any of those things. Next slide, please. In the London Leadership Academy, we also developed some little webinars which were based on, we were running a PCN development program, and we were running it just as the vaccine clinic stood up. So people genuinely with the best will in the world were on screen in scrubs with masks going out to do vaccinations or something. And what they said would be more useful is stuff that they could come back and look at. So these are about 30 minutes. They were delivered as a lecture, or people who were there could interact with them. They're on the LLA YouTube channel. And if you prefer to kind of watch and be talked to rather than have to trot your way through a read and learn module, they cover some of the same ground, but it's another way of accessing that information if you want to. Next slide, please. And then there's a whole load of structured programs. So I know you definitely have 2 people who have done Rosalind Franklin and Nye Bevan, who will talk to you about what that actually feels like. At the moment, the Leadership Academy has some of the programs are paused just while we go through this marvelous creating the new NHS restructure. But there's a couple that you can access straight away. So the Edward Jenner program is it's a self-guided short course that people usually take up to about 6 months to complete, and it's an introduction to leadership.
It's very nice, but why are you here?
Somebody just joining in and heckling me, right? That's awesome. There's the Mary Seacole. We're currently in London. We are running that for primary care workforce with the training hubs, and we're looking to how we expand that further. So it's our first time in your leadership role. It's a bit more structured and it has more input, because at the end of it you have to do an assignment. And the reason I'm saying that is because people have found that more difficult than they anticipated. So if you want to do it, we'd love to see you, but have a think about whether you can commit, because that one is quite rigid about the timescales you complete in. Rosalind Franklin is longer, a little bit longer, 120 hours with full workshops. I know someone is coming on to talk about their experience of that. And I also know they adapted it. They had some cohorts specifically for nurses, which I believe were really successful. And then Nye Bevan is at one point it was described to me as someone for aspiring CEOs, but it's for more senior staff. And again, I know you have someone who could come and talk to you about what that was like and the impact it had on their career development. Next slide, please. Yay, that's me done talking at you, right? So these are the links to the things I just talked about. Within that, there has the Leadership Academy events page. So we are tending to run more and more webinars that we would also record and maybe put up on the Leadership Academy YouTube channel, because everyone acknowledges that it's a difficult place at the moment, the NHS, isn't it? And with the best will in the world, you can get called away at very short notice. But you can see new events that are coming up there. And we also have, if you go on the website, you can also access the newsletter link. So if you wanted the newsletter, it goes out once a month. It's electronic. it's not an onerous thing, and mostly what we do now is promote any upcoming events in there. And I would say finally, I think my email address at the beginning, if there's something you think the Leadership Academy through me could work with you and your group specifically on, then let us know. So we've done a whole bunch of things kind of on the back of that. So we did some work with GP appraisers around how they could use coaching techniques in their appraisals. We've done some work with AHPs around influencing without formal authority, and that a small group of them are starting to become action learning set facilitators. So always interested to hear about anything in particular you think we could develop specifically with you. I think I'm going to stop there because there are other people coming to talk after me, but I'll be around. So if you have questions for me, do please ask them or email me afterwards. Thank you.